Hi everyone, it's Lisa Moeller with MedMark and welcome to DocTalk Dental. We are especially privileged today to have Dr. Ace Goerig chatting with us. He is a board-certified endodontist that has practiced over 40 years and has worked with 20% of all of the endodontists in the country with his courses and coaching program. He created Endo Mastery in 1996 to help endodontists work less, enjoy their practice more, while increasing their fun and profitability. Dr. Goerig is one of the most profitable endodontists in the world, while working less than 125 days per year. Today, he will talk about the ACE process and the Retire in Practice model, showing how to enjoy and love your office where you never burn out. This has helped many endodontists double their net profit, eliminate drama and stress from their office, while only working 3 days a week. Wow, that's an amazing concept. Welcome, Dr. Goerig.
Well, thank you.
Can you teach me how to do this 3-day-a-week working thing? I would love that.
Yes. First, you have to go to Endo school.
Okay. That ship has sailed.
No, exactly. No, it's a fairly simple process. But yeah, the whole part of this is when I left the military in 1991. I started to practice, and what was crazy about this is even though I was a full colonel and had a lot of administrative time in the military, I brought in a local practice consultant, and I looked at different models that was out there, and I'm more of a one-appointment endodontic person, but these models were multi-appointment endo. Mm-hmm. The problem is that I was working like 5 days a week, 12-hour days, killing my staff and myself, and it just wasn't fun anymore with this model. So then I realized one day I walked in I came into the office on Sunday, I looked through the drawers, I saw all these bills that weren't paid, all these checks that were not deposited. And apparently I was not paying attention to the business. Mm-hmm. And of course I was 9 months behind in payroll taxes and my life insurance had been canceled. So I had to look at that and see what the problem was, and I finally brought in a practice management consultant, Linda Miles, one of my favorite ladies. Mm-hmm. And she set up systems and a model. And once I did that, I started focusing on one patient at a time and just started having fun again. And of course, my entire staff probably left, except I had to bring new people on. But it was a very interesting experience. And I realized when I was talking to this fellow in 1996 at one of the endodontic meetings about how to be more successful in practice. Mm-hmm. And he says, you ought to put a course on. And I said, okay, I'm going to do that. So I sent out letters to all the endodontists, and I rented out the ballroom at the Red Lion for 500 people, and I was getting a little worried when we had about 2 weeks left. I had 3 people signed up, so I called every endodontist in a 5-state area, and eventually
called in all your favors.
Exactly.
Yeah.
So we had about 20 people on our first meeting. That's how we sort of
started. And how long ago was this?
It was 20 years ago.
20 years ago.
Actually, 21 years ago. Mm-hmm. Yeah. So it was great, and that's how we started, and we started coaching people there. We had 4 coaching clients now. Now we do around 50 a year, so it's good.
I love that you figured out within your own practice what needed to be fixed within the industry, right? Yes. That you weren't having fun, that there was such high burnout, and you were experiencing all that yourself. So I'm sure you thought to yourself, hey, how can I help? Yes. Others with this, right?
Well, and also it was amazing because when we went into practices, we saw all these things that we learned from. I mean, I always say if you want to learn something, teach it if you don't know it. So, right. And so I went into these different practices, and we just continued to grow and get better and better as we coached other people. And then my practice got better and better too, which
right.
was great. And I've had many coaches also. And I
so who have been some of your mentors and coaches?
Well, they're for general dentists. Greg Stanley was one of our mentors. Bill Blatchford taught me some things. Also Mike Abernathy. All these are general dentist coaches that mm-hmm. Have been out there. And but it's been a kind of a neat journey. Yeah.
Yeah. Well, you are the master of endo. I mean, literally, that's your reputation in the market.
Oh,
I can attest to this because I have an endodontic magazine.
Oh,
so
very good.
I know
Thank
these
you.
things.
Thank you.
No, all joking aside, what you're doing is amazing in the industry and much needed. Tell us more about your ACE process. Let's hear about that.
Well, the ACE process is basically, it begins with a vision and intent to have the practice of your dreams. Mm-hmm. And we start training your team, helping people understand how they relate with patients and things like that. And we create an office culture that provides like the wow experience, sort of like the Ritz-Carlton of dentistry. I mean, this is where you have to differentiate yourself from anyone else out there. And when you're able to provide a process like that, or that type of connection, because when you have those relationships with your patients and your referring doctors, it's sort of like you develop like an emotional connection. And
right.
Patients just love that. And then you add that to creating the flow in your office where you're very efficient, the patients get done quickly, and they just have a wonderful experience. And then once you have that going, then in our process, the people we work with usually can increase their, do two or three more cases a day. The average endodontist is like 3 to 4 cases a day.
Wow.
And but you add 2 or 3 cases a day, you're increasing their net profit by maybe $500,000.
Absolutely,
And
which
then,
is huge.
The big thing with endodontists, and especially these new students coming out, they have so much debt.
Yes.
And you had $500,000 a year, or pay your taxes on it. Within 3 to 5 years, you're completely debt-free. Then you go to practice. Then you go to the office because you want to, not because you have to.
Right.
And that's really when the fun begins.
That's so important,
Yes,
right? It's so
yes.
important to
Yeah.
free your mind of that debt, so that you can get on with what you were really passionate to do.
Right. I mean,
right?
But, what's interesting is that once you make a plan to get this way and to do more cases and rearrange your practice, then you can live now as if you're debt-free, because you know you will be. And so you don't have to wait till you're debt-free. You just have to have the system and the process on track. So.
And you call it retiring in practice.
Well,
so tell us about that.
Well, it was
That's
interesting. I was working my 5 days a week, 12-hour days, and then finally got a coach in. And then around the same time, I was talking to one of my older general dentists who referred a lot of patients to me. And he said, yeah, I only work 3 days a week. I said, how do you do that? He said, well, it was interesting because when I first started in the 50s, everyone worked 5 days a week. And my buddy from dental school, a year into it, he says, I'm only working 4 days. You can just change your schedule around. And he did. And he said he made more money in 4 days a week than he did in 5. And he says, I wasn't a big spender, so I paid off my debt. And within 6 years, I had no debt, so I went down to 3 days a week, and I was taking 2 weeks off. Over the next few years, I started taking 4 or 5, and eventually took off 12 weeks a year, working 3 days a week. I've been retired in practice for 40 years. Now, this guy was in his 70s. He retired at age 80. And
wow.
in his 90, he skis the mountains with his great-grandchildren.
Oh, my
and
goodness.
Just incredible because, I'm 73 years old. And I go into the office and, I complete maybe an average of 13 or 14 cases a day, never stressed. And at the end of the day, I'm not tired because it's all about systems. I've empowered my team to run the practice.
Right.
And they run the practice, and I just walk in and just love patients. That's all I need to do.
Oh, that's amazing.
It's fun.
If you have the right people and the right processes and the right people's processes product, I think is what it is.
Yes.
That seems like that's what you're about and what you're teaching other doctors to be about with their practices.
Yeah.
So that's amazing.
The problem is no one ever teaches the business aspect. No one teaches the flow.
Right.
It always amazes me. I ask endodontists, how long does it take you to do a normal root canal? And most endodontists have been out a few years, so it takes an hour. And I'm saying then, so you're there 9 hours a day. Why are you doing 3 cases? Because it's not about your clinical technique. It is all about the flow and how you move patients in and out. That's all systems. Those are things we teach, it's the systems.
And doesn't that really start with, like you said, an amazing team around you? Speak to how important that is.
Well, yes. Well, it's interesting about systems. You need systems so you can hire on personality and not on experience. I hire a lot of new people, and the 3 people that I have up front have never been experienced. They were in their 20s, never had any experience in dentistry or anything like that. But with the right systems and manuals and things like that, they're able to handle a multi-million-dollar endodontic practice. I mean, and move
Nice.
patients in and out, because if you have the right models, and we have a lot of videos and things like that that we share with our doctors we work with, we get them up to pace very fast.
Right. So what are the specific systems that need to be evaluated in the endodontic practice?
Well, first of all, you have to be able to train your team, you know, on insurances, how we handle phone calls. The difference with other, you know, practice management, they understand general dentistry and hygiene and all those sort of things. But we schedule differently. We ask different questions. We have to understand, does these cases really need treatment, or they don't need treatment? And then that puts us where we schedule them properly and things like that. And so once we have these systems in place, then everything flows pretty easy. It's looking at that. It's looking at the practice monitors that we have to keep track of the numbers of the office. It's amazing how many endodontists do not even, they look and say, well, it's in the computer, but they're not tracking that. They're not tracking the referrals, and where they're coming from. Is what we're doing make a difference in the patients that are sent to us, or how many patients that are sent to us?
Right.
And placing monitors in the practice like that make a big difference.
Yeah.
Yeah.
So tell us about, so you have Endo Mastery, your 2-day course.
Yes.
Give us the highlights of what our doctors would learn at your course.
Well, this is kind of what's really a day and a half. It's a comprehensive course that, where they learn a step-by-step approach to creating like these processes. Basically, here are the different systems. We talk about the first and most important thing, as I talked about before, was creating a vision. This is, you know, if you can create a vision and have an intent to get there, it's amazing how things go. We talk about goal setting, those sort of things. Then we talk about the team and how we eliminate drama in practice and how to start having more fun. So, example, let's say someone drops all the gutta percha on the floor. What's the first thing we say? Great, you know? As soon as we screw up, we say no. We never say oops. So we say
never oops.
Great, yeah. Or we just laugh, because none of it really matters, you know. And we just keep on moving through the day. I mean, it can just be, you know, a lot of fun, you know. And then we also look at the other things in the office that really kind of make a difference, the flow and how our patients are moved in and out of the chairs and those sort of things. We'll teach them that at the meeting. Then we look at business systems, how to collect at the time of service, all those sort of things. And I also talk about endodontic technique. I mean, I've been doing this for over 40 years. I have plenty of experiences in working with these offices, and so much. I've learned so much by working with different doctors, and we just keep bringing it back to our practice. And so there are a lot of tricks that we talk about in endodontic technique as well.
Right.
And then also, because we have teams there, what we like to do is teach them how to have personal and financial freedom and understanding debt reduction. I think we talked about this.
That's huge.
Yeah, I eliminated the the retirement plan in our practice just because when people left, they cashed out the retirement plan and they learned nothing. Now I give them a certain bonus each year for debt reduction, and hopefully within 5 to 10 years they own their house, their car, and everything. And the only problem with that is that I've had a few people that finally got out of debt and quit. But it's okay.
Yeah.
At least they're debt free.
Yes.
I can bring someone else in.
You taught them a little too well.
Exactly. I mean, that's exactly what I wanted to do with them. So it was great.
Yeah.
So then the biggest gift is not getting out of debt. The biggest gift is to change them from spenders to savers. So that's fun.
That is such valuable coaching, and I know that's a part of your Endo Mastery program.
Yes, it is.
To have the coaching process along with it that kind of brings everything full circle.
Yes.
And that's an amazing component. You and I were speaking off camera earlier about that. So tell us how important that is to you.
Well, I'm really committed that not only the doctors but the team members get out of debt. I always see debt as the devil, and it's the fastest way actually to be financially free. Debt as we talked about, by paying off debt, is you can make almost 100% return on your money just because what you pay for principal and what you also pay for the interest on that is over 100%. You know, you might pay, $500 toward principal, $500 toward interest. That's just not a 4% loan.
Right,
and
right.
So anyway.
Well, and we also talked about that just because you get out of debt doesn't mean you're automatically insta-happy, right?
That's true.
I know.
But you think, and that's one thing that people find out, because sometimes it only takes 2 to 5 years for a dentist and an endodontist to get out of debt by adding 2 or 3 more cases a day to the practice. And then we have people, and they say, well, I'm still not happy. And so that's when you have to start looking at other things in your background that, hold you back from,
Right.
just enjoying life.
That's a whole other coaching program,
It is.
right?
That's another
But
coaching
still
program.
important to
It
the
is
quality
very
of our
important.
lives.
Exactly.
I think it's important we all take a look at that.
I think so.
Don't you?
I do.
So tell us what you do in your free time. It doesn't sound like you have much free time with as busy as you are.
Well, I always like to do things one-on-one. I have, 5 children, 4 daughters, and a lot of
And
times.
you've been married to your lovely wife for 48 years.
48 years.
That
yes.
is amazing.
Yes, thank
Congratulations.
you. No, yeah, we have to congratulate her for hanging in there, is what I say. But that's because I've always had the last word. And that is, of course, yes, dear, you're always right. I'm sorry. I mean,
exactly.
Exactly. It's just so
wow.
simple.
She's trained you well.
Exactly. And when my wife has a problem and I can fix it immediately, I make no suggestions. I just smile and listen. It's
Nice.
perfect.
That is
Exactly.
perfect. Love it.
But I love to ski. I love to just take off and go on vacations. I do this with my wife, and sometimes I'll have one-on-one with my children. Like one of my daughters, Catherine, we flew to Papua New Guinea for 2 weeks, did a dive trip, and it was fun. And my son will go fishing, or I'll just bring the entire family to Hawaii. But I've got all this time.
Yeah.
I mean, really, I'm only working. I mean, look, I'm 73 years old, and it's still fun. And I think when you have set up a system where it is, you can go in and it's all about just enjoying the patient and the relationship. I mean, as we all get older, we realize it's not the money anymore.
Right.
It's the
That's
relationships.
True. That's true. And you've got how many grandchildren?
I just had my 13th.
13?
Yes, this last Monday, so it's great.
That's really got to keep you young, right?
It does. It's very
Running
exciting.
around with them. I bet that's so much fun.
Yes, and actually, most of them live within probably 3 or 4 miles from my home. So.
Oh, that's awesome. That's
good.
awesome. So the tagline of your business is transform your practice, transform your life.
Right.
And I think that's really what you're doing. I think that's been your goal, and that is what you're actually doing, because
Right.
you're helping a lot of endodontists change their lives by just rethinking their practice and how they're doing business.
Well, the problem is a lot of endodontists have their head in the sand. Endodontics is changing.
Right.
I mean, there are more corporate offices out there. There are more insurances just taking majority of the money that you're trying to get, from the patient and giving you reduced compensation. More endodontists out there. There's more general dentists doing endodontics. If you can offer them certain things, if you can offer them an incredible customer service, an emotional connection with them and the referring doctors, if you can see their patients that day and provide efficient endodontic treatment and get them packed that day and complete the case that day, they're actually, what is amazing to me, a lot of general dentists stop doing endo because it makes it so much easier.
Right.
A lot of the people that talk to me, they've got all these difficult cases. I don't. I do get my share, but the majority are straightforward cases because the general dentist finds that these things take too long and they can make become much more profitable just by doing, let's say, crown and bridge and things like that.
Right, right.
And it just and if we don't make change, we can't make our office more efficient, more fun, more open to patients and really taking care of the patients, then things may get worse. So.
Wait, did you say endodontists and fun?
Yes, it's fun.
Can that live
Well,
together?
no, really, actually, it depends where you're sitting. At the chair or, on the outside.
Right.
Exactly.
I mean, endodontics it's a very serious specialty, right?
No,
no,
it's not.
Okay,
Oh my God.
So it can be fun.
It is fun.
That's awesome.
I mean, I
love
can
to
make
hear
any
that.
patient laugh in the chair, once we strap them in. No, it's just fairly simple.
They're captive.
Exactly.
So you've got a course here in Scottsdale,
I do.
which you're kind of killing two birds with one stone here with our interview and your course.
Yes.
Lovely time to be in Scottsdale, I might add.
Oh, it's beautiful.
The end of January,
Oh my
isn't this
goodness.
weather gorgeous?
I just left rain and rain and rain.
Yeah.
It's,
We can't shovel sunshine, so we're happy all the time.
It's
good.
beautiful.
So tell us about the course that's happening tomorrow, right?
Yes.
Tomorrow?
Well, like I said, it's a 2.5 day continuing education course, and like I said, we go through all our systems and we show them exactly how I do it in my office. I don't hold anything back. And in the old days, when I first started this thing over 20 years ago, we used to charge $1,000. I said, if we charge enough, then they'll actually might listen, And we could fill up our courses and things like that. I'd make money at it. Then I realized, what am I here for? And so 4 years ago, I reinvented the entire Endo Mastery and brought more people in to help me through the process of, coaching and things like that. And now we just basically our course is will be charged just covers our expenses.
Right.
Because my legacy, the way I see it, is that I want to be able to save private practice endodontics. If we can get these endodontists to understand the true systems and just start loving your practice again. And now there's a point, the average endodontist does around 700,000 in collections a year. And they think they need an associate who's going to have some time off. The greatest stress they have, endodontists, is when they go on vacation because they're wondering who's stealing their patients. Well, really, it's sad.
Yeah, oh, that makes sense.
Isn't that sad? You're on
Yeah,
vacation and
that is
I can only
sad.
take a couple of weeks off.
Yeah,
So
sad.
our goal is to get them to about 1.4 million, which does not take that long to do with a few more cases a day. Once they're there, then they can bring in an associate. Now they can be open 5 days a week. They cut down to 3 days a week. Their associate works 3 days a week. And you can take all the vacation you want. The office is covered. You never worry about that. Your profitability jumps, personal profitability jumps. It's just that's pretty much the ACE process to
I
get
love
them
it.
there. Yes, good.
That's a win-win.
It is a win-win.
Awesome.
Thank you.
So this is so great. And I'm so thankful to have you writing and contributing to endodontic practice as well.
Oh, great.
To my magazine. We love that, and you're writing the intro for this next issue, and we so appreciate you and everything that you're doing for the industry.
Well, thank you, and I love your magazine because,
Thank
I mean,
you.
basically, we don't have a magazine that just gives common sense, ideas, for our endodontists out there. I mean, we have our research, our Journal of Endodontics, but this is a different approach.
Thank you.
No, I love
Well,
it.
we're filling the niche that I intended to fill, because there's the Association Joe, the journal, and then there's the tabloid journals, and there was nothing that was in between that was user-friendly, hands-on. I can read this article and go perform this technique in the next room and actually have it work.
Right.
Which is our biggest compliment that we receive from doctors. So
Absolutely.
it's pretty amazing.
It's
So
been good.
thank you. Well, let's keep up the good work and keep getting the word out there.
All right, perfect.
Thank you so
Good.
much for joining us
yeah,
today. It's
and-
been a pleasure.
Oh, thanks for having
All right,
me.
you'll come back?
And I will.
Okay.
Great.
Awesome. Thank you.
You bet.
Take care.
Okay.
Thanks so much for joining us today on this special edition of DocTalk Dental. I'd sincerely like to thank our special guest and sponsor of this episode today, Dr. Ace Goerig. For more information on him and his amazing company, please go to endomastery.com. As always, for more info on everything endo, please go to endopracticeus.com and subscribe to our publication. And check out our DocTalkDental.com site to view this and other engaging episodes. Thanks again for joining us. I look forward to seeing you again soon on the next DocTalk Dental. Take care, everyone.